tended to look at this presentation in alignment with the IHR, and knowing that most of us, our member states, have gone through JEE, I looked at what we need to do along the lines that we were assessed on, but giving you a background based on the Rift Valley fever, just to tell you that, let me try this. Okay. Of course, I have no conflict of interest, declare. And like I've just said, just looking at that simple outline, how this has happened and what the role of NPHI should be. Let me say here that unlike my two predecessors, in Kenya we don't have a National Public Health Institute. It's the Ministry of Health with different arms and units implementing different core capacities. Some of these implementers are outside the Ministry of Health. And so we can't overemphasize the need to do overall coordination if we are to succeed. This is just to inform you that Rift Valley fever was actually first identified in Kenya about a century ago now, but it has been recurring every 5 to 15 years. We know very well that it is from animal to animal, mainly almost 100% is through mosquito transmission. But when it goes to humans, then the story is different. As you will see in the slides that will follow, looking at the characterization of those who are found to be positive. It's important for any entity dealing with infectious disease to understand thoroughly, and I've seen this in the previous presenters, that you have to know your epidemiology well. You have to be able to map the various areas that you're dealing with in terms of what is the risk profile for each of them. This map only shows the risk profile for Rift Valley fever in Kenya, and I can tell you the latest infection, as I speak, is ongoing in one of the countries that is not, right now, not indicated as a high-risk county. But that's the point, that we need to be very alert. We need to be on top of things. We need to study our data. We need to go down to the community to be able to address the things as events emerge. And the other thing I want to mention about this map is that much as you see these are all marked, I don't know what color that one is. It might be yellow, it must be brown, depending on how, or orange. But not all of them, again, are affected every now and then. So just to give you from our studies, courtesy of the FELTIP students, what happened in 2018? Just a chronology of events showing you clearly, and this is almost always the case, that you will get a warning from meteorological department about impending long rains or heavy rains. This will go. The next thing you will know is you're being told there are reports of abortion. And so it means once we hear about long rains coming, it's important to be on high alert, but also enhance event-based surveillance wherever it happens. And then before you even respond in good time, because I'll also show you the delays that occur from the time that abortions are reported in animals to the time that we have a human case, nothing much will have happened in terms of response, and not only responding from the point of view of animal health, on the human health, but animal, which is key. And then you realize that by the time you get to laboratory confirmation, a lot of these events have occurred, and you're almost saying you have lost some lives, which is very unfortunate. And by the time you have multi-sectoral teams in place and going out for investigations, it must be too late. So the important thing that NPHIs or entities dealing with public health events of international concern need to do is to map out very clearly the stakeholders and do analysis. Who is strong in what? What can they do better than others? Where are they situated? What capacities do we have in terms of laboratories? And this goes down to the lowest level possible. Just to remind you that Kenya, since 2013, devolved the functions, largely health functions, services to the 47 counties, and the national level remains with matters, training, policy, guidelines, to be able to be overseeing what is happening in those counties. But surveillance, most of the time you'll find, is still very, very weak at the county level. And this is why we have such kind of delays that do occur most of the time. I said that coordination and partnership are key, because this provides us with synergy in actions. Most of the time you will find if this isn't there, then each actor will be doing his or her own things in the area where they work without necessarily getting to know who is doing what, and sometimes its use of resources may not be optimized, and of course efficiency in operation becomes wanting. And that increases, if it happens, it increases the risk that this spread will be much further and beyond what we know. So coordination and partnership, very key for any public health institute that is geared to control and contain these infectious diseases. One thing we must realize that the infectious diseases are very, very fragile. You might think you have cleared the infection, but within a short time you relax and it's back in full swing. So we must at all times remain alert and knowing what we need to do. Actually, if you listen to all the presentations that we have done since morning, that we have been presented here, there's one key thing that we need: systems organization, and think wider than just health. We really need to think wider than just health. In fact, with Rift Valley fever, it presents the best case where One Health action can be seen and needs to be seen to work. And so in Kenya, for example, we have a committee that sometimes it's called a task force when things are hot, but occasionally, most of the time, it's just a committee that would be called upon to advise whenever there is a potential outbreak of Rift Valley fever. And of course, in Kenya, we have 3 main laboratories where the diagnosis can be done. This is Kenya Medical Research Institute, and the veterinary one, the Central Veterinary Laboratory, and then we have the National Public Health Institute. All these 3 are in Nairobi. And yet, if you looked at the map, Nairobi is not one of the centers or the places where, or the places mapped as having the most risky areas that probably the outbreak might occur in. So the referral of specimen becomes key, but in doing this, we must always, at all times, realize that we need to observe biosafety and biosecurity principles. And therefore, in my next slide following later, you will realize that when we're doing this, it's key to be very strategic if the plan is from the very beginning, because some of these things you are doing because they were found to be there. And of course, the workers there are likely to be in places they would want to be in towns where amenities are good. But the reality is we need to place these laboratories strategically in places where they would serve best without a lot of issues about transportation, which exposes us to further risks. Of course, the NPHIs have and indeed need to develop and standardize training materials and guidelines so that the application of the knowledge that we are talking about, the application of all the tools is equal and applicable in every part of the same way you would have it in one corner, the other corner is doing it. I think that is key. So under prevention, what are the roles? One is to identify gaps through regular simulations based on the JEE, and of course, if you have done National Action Plan for Health Security, then you would definitely know this is one key area that you will realize the gaps that are there to address them before you reach an emergency status. The other thing that is key is to invest in human and animal workforce. I think this has been said in many presentations, and it's key that we do this because, as I've said earlier, the problem begins from the animal. And it takes about 2-3 weeks before we see it human beings. If we were able to address this problem when it hits the animals, then it means you have done the prevention. It won't reach the humans. But rarely do we do this. Continuous surveillance and research to map out the hotspots, including international borders, is key. And of course, the community sensitization has been emphasized. More so, as you will realize that in the next slide, we are looking at those who are exposed and are found to be positive. What did they come into contact with? From this list done last year by the team, there is no mosquito bite. It's all about contact with meat, milk, handling the animals, herding. So it is all about contact with the animals. And when we talk about community up there, and you'll see the areas or the people that are affected, then it tells you most of these counties that I showed you again, the people there almost entirely depend on animal for their daily livelihood. Even what they consume is almost always from animals. So when you tell them to avoid this without offering an alternative of what they are going to use, it doesn't make sense. And again, it's a place where anthropologists probably need to come in and help what needs to be done so that we are able to avoid this transmission to human beings. Detection. Like I said, laboratory is important. My colleague also said, without that, you'll never know what you're dealing with. This Rift Valley fever presents like malaria, which is common in Kenya. And you didn't know until you have tested for the mild cases. And so it's important to do this, but again, strategic installation is what I was referring to in terms of geographic and epidemiology, knowing where it matters most, where you need to have this laboratory testing done nearest the source to avoid exposure to the other risks. Of course, that has to do with sample transportation. You find most of the time, unlike what was presented here, we don't have a specific van that is doing that transportation. And you might find sometimes an individual carrying this sample in a bus or that is carrying everybody else, and you never know what happens if somebody comes into contact with it. So those are risk factors that make us think we need to have laboratory installations in the right places. Of course, reporting is obligatory from Kenya, but then it has to be timely, accurate, to inform decision. Otherwise, it's of no use. and also gives us a way to respond faster and effective. Because when I had in the morning presentation that we have a platform, for example, that we are sharing information across nations, is a good thing. And I thought this needs to be implemented in every region so that you can actually know. Although for us in East Africa, Eastern Africa, RCC, we do it like Zambia said on ECHO platform, but it's very informal. We need a formal way of doing this. It's very informal because we would be told we have this many cases, we have that many, but at least we know that in the neighborhood this is happening. The information sharing is therefore key and cannot just be within country but must be across border, knowing that diseases know no borders, and any moment you have an outbreak of Rift Valley fever across Tanzania, we have people who live on the borders, and the grazing patterns go across. It's not just within Kenya only. The same with Ethiopia and Kenya, the same with Sudan. Now, this is just to show, fortunately I'm not sure if you can see very clearly, but the graph on the left is outbreak in the animals, and the one on the right is in humans. And there is time interval that you realize that it takes before we see it in humans. And then the worst bit of it is that even as we start dealing with the human cases, the animal cases are still on. They're still going on. And my colleagues in veterinary in Kenya have always complained, why is it that we wait until a human being is hit and especially dies? That's when we go into action. That's when you hear now people saying there's a problem. Yet this disease causes enormous economic loss from the animals to the sick people to the loss of lives. Why don't we start early enough when there are early warning signs, and latest when the animals are seen to be affected? Under response, we have a lot, and we think apart from linking with security agencies to enforce certain regulations as per the Public Health Act, including ban of slaughter and safe livestock and livestock quarantine to and from the affected areas. As I said before, we need to do soft, not just hard, but soft in terms of giving alternatives to these communities to be able to partner with us so that they understand that we understand what they're going through. Build capacities for the first responders, and the surge capacity should be known within the region where you're working. Of course, we need to strengthen case management at all levels. And the investigations as swift as possible, both human and animal, both active and passive, and the sample transportation to labs with diagnostic capacities be done as quickly as possible if we don't have that capacity nearest where the occurrence is. Now, this, my last slide, has been emphasized in different ways from almost all the speakers, and I can't emphasize better than what they have done, that resource mobilization and advocacy are key. Of course, using a language that economists understand, because this is another problem we have. We think that by just saying so many people have died, or if they don't care, your people will die, it doesn't really work that way. I want to agree with the previous speakers. It's important that we devise the means and ways of making sure that our advocacy is giving us fruits from a multi-sectoral, multidisciplinary team to be able to reach every constituency that matters when the Rift Valley fever infection, as far as Rift Valley fever infection is concerned. For purposes of this presentation, acknowledgement to the listed organizations and units in the Ministry of Health. And thank you very much for listening.